Hello, welcome. Today we're going to be talking about some health-related challenges with respect to aging. And primarily what we should understand is that aging is not a synonym of disease or disability or illness. The fact that we are old does not mean that we are sick, because there is a possibility of getting older while being in good health. So we're going to talk about the challenges that we could possibly face because of old age, though some of them may come as a result of illness, but this is not a definition of being old. Aging is not sickness. The thing we're going to talk about is mobility issues. Generally, with aging, there are a lot of changes in the musculoskeletal system, and this causes some difficulties in movement in the elderly. Now, what we have to do is to help them to maintain physical activity, not allow them to just be sedentary and not do anything. Help them with range of motion exercises. This helps them to make the muscles to be a little bit active, and also you could help them with canes and walkers, or make adjustments in the house that will help them to be able to move around. One is the joint pain. Elderly persons may very often complain about joint pain, so to help them, it's a challenge to face, yes, and definitely we have to seek ways to help them. You're going to want to check what they are eating, too much protein food, and also help them in range of motion exercises, as cold or heat therapy could be equally used to help alleviate the pain they're feeling at the level of. The next thing elderly persons may face as a challenge is loss of vision, visual problems, and they may be able to see near or to see far, and they find it as a challenge. So if you want to help them in the house, the painting should be contrasting colors to help them be able to identify the various places. You may want to help them with magnifiers in case they want to read, or offer them books with large prints that will help them to be able to read as well, and try to use visual aids that is going to help them to be able to express themselves and see what they want to see too. The next thing is usually hearing loss. There is a gradual decrease in the ability to hear properly, so we necessarily don't need to shout when we're talking to them. You may want to get close to ensure that when you're talking, they're hearing what you're saying, to help them understand what you're trying to say. And it doesn't matter how long it may take, you may say something and repeat it as often as possible to ensure that they've clearly understood the message you're trying to pass across. Memory loss. With aging, there could be memory loss, and this is termed age-associated memory impairment, which happens with respect to age because of neurodegeneration of the nerve cells. Now, for us to be able to help the elderly persons who are going through memory loss, we help them with memory activities, puzzle games, reading, and we assist them to be able to short-term memories like reminder, and helping them around to be able to recall a couple of things even if they can't. It doesn't matter how long you have to repeat something you told them, maybe they have forgotten. Just say it kindly and in a loving manner. Yeah, help them through this stage. Incontinence. A lot of changes happen during aging, and this is equally one of the challenges with aging, incontinence, because there is inability to be able to maintain the dexterity and the flexibility of the bladder or the rectum. So we may find elderly persons who are incontinent, and sometimes they may not even realize that that is what is happening. Now, we don't have to be so mean on them, because it's not like they want it. If we have an elderly person who is having an incontinence, all we need to do is just to help and ensure that they maintain their cleanliness and that they are clean. At each time when there has been an incontinence, we just clean them up and make them to be neat. We could equally help them with pelvic activities and try to see how they could have their bladder maintenance, even if they have to go for 30 minutes. But for us to avoid them being soiled during the incontinence period, we have to be beside them and ensure that at each time when they want us to take them to the bathroom, we are ready. Because definitely if you're far away from them, the time they call and then you are to come, definitely they would have had an incontinence upon themselves. So we have to ensure that when we have elderly persons with incontinence, we always have to be beside them and be quick to act. So like I said from the beginning, this does not necessarily mean that the elderly persons are sick. though some of these may come as a respect of an underlying health condition. As such, it is imperative to be able to clear out the disease condition and make sure that this is not actually related to a disease. Hence, we always have to seek advice from a medical personnel to be sure that the decisions we are actually taking are the best for the persons we are caring for.